Hello, this is Jane Coombs of Working Well Solutions, and I'm doing an updated session on hand-arm vibration, which we call HAVs for short. I'll explore causes, effects, laws and prevention. Because HAVs remains one of the most reported occupational diseases in the UK, but it is entirely preventable with awareness and good practice. So why does this matter? It matters because HAVs continues to affect workers in many sectors, and I'll be going into that in more detail later on. But it affects the nerves and blood vessels of the hands and arm, and once they're damaged, they rarely recover. Prevention and early reporting are the keys to saving careers, because you can do an intervention then and look at ways of controlling the high risk of vibration on your hands. Vibrations, say in a power drill or a saw, may feel harmless, but constant microshocks wear down tissues. Over time, dexterity and feeling fade. Another thing with vibration is vibration white finger, which is recognised as an industrial disease in the UK and caused by prolonged use of vibrating handheld tools. You can see this when I don't know if you've ever seen somebody with a very white tip of a finger or a whole finger that's white, and that is vibration white finger, which can be caused by other diseases, but it does affect the nerves, muscles and joints in the hands and arms. Of course, which fingers are affected is about which tools you're using, the power of your grip, how much vibration goes from the tool to your hand, and if it's your right or left hand. All of these things make a big difference, and nobody is the same, so there has to be some form of looking at the risks of vibration to all workers who work with these tools. The HSE has a long list of tools that causes these problems, but what we're thinking about is the types of workers that would possibly have this problem. So you're looking at construction, people that use lots of drills, pavement breakers, that sort of thing, utilities, manufacturing, forestry, all of these people, and they will need to have a full risk assessment and look at what their exposure is to prevent long-term problems. So workers need to be aware of the early signs of hand-arm vibration syndrome, and that's looking at tingling in the fingers, perhaps numbness, loss of feeling. If they continue using this machinery, still getting the exposure, it can go on to cause finger blanching, the white finger syndrome we talked about, poor grip, pain and a colour change. Of course, the UK has supported workers by producing relevant legislation. These laws remain valid, and employers must assess exposure, control risk and report hand-arm vibration cases under RIDDLE, which is the Reporting of Injuries, Diseases and Dangerous Occurrence Regulations. There's also EU's directives, and then there's the RIDDLE reporting set of requirements where you have to phone in or report a RIDDLE incident. And it's usually a group of workers. It's unusual to have one worker that has this problem. Part of the legislation which I've just talked about is setting limits for workers and how much exposure they actually get. So you're looking at the exposure action value and the exposure limit value. So the EAV is measured with a machine, and it's looked at over 8 hours. That's what the 8 refers to. And then the same for the limit, except that the worker cannot go above that limit in terms of their exposure. But with EAV, the first box, then the employer knows that there's an issue and has got to make sure that they keep within those limit values. So the important responsibilities here lie with the employer, and there's 4 main responsibilities they have. They need to assess and control risks, and that's about looking at workers, looking at the work they do, the temperatures they work in. Secondly, they need to reduce exposure as far as reasonably practicable. As you know, that's a term used in health and safety legislation. Then they need to provide training for the workers and also health surveillance, and that's the thing that I tend to be more aware of as I was occupational health. And then finally, keep and review records. And it's not just one review. They must actively manage exposure, not just assess once. Maintenance and health monitoring are ongoing duties. So how on earth do you measure vibration? Well, we measure vibration strength in 3 directions, from up and down, side to side, and front to back. So if you imagine some tool vibrating in those ways. When you look at A8 in that limit values you saw, it's a daily average exposure over 8 hours. And it's just the standard way of saying that's what your average vibration exposure across a full working day based on 8 hours. Vibration is measured as acceleration, and the 8 figure standardizes exposure so it can be compared against the limits that were already set out in the legislation. It's a bit complicated, but once you get the measurements, get those done by an occupational hygienist or something like that, then you get the limits, it's all set out for you, and you can identify and control the risks far easier. So I've just mentioned the 3 planes of vibration: up, down, side to side, and backwards and forwards. That's the triaxial accelerometers examples. I know it sounds like something out of Star Wars, but there are machines that do this. One is HaveSense, a UK-based system that attaches the tools or to the workers and records the vibration exposure. Very simple. Then there's space bands. These are wearable wristbands, a bit like the Fitbits or something like that, that tracks vibration exposure and gives you a reading. And then there's general vibration measurement equipment, and this is for the more high risk or likely to be a problem, often used by occupational hygienists who come along with data loggers too. So quite a complex operation to measure vibration. So how can employers reduce exposure? Well, there's a number of ways. Firstly, you could stop doing the work that required the vibration, which isn't on my list here, but that's one of the ways of doing it, or you could outsource it. You could use low vibration tools, and there's a number of these made nowadays. Maintain and replace equipment. That's good. You buy new equipment that's up to date with standards, with CE marks. You maintain and replace, and you also do regular maintenance, which is very, very important with tools of this type, especially if they're not sharp. They need to be sharpened very frequently. The other thing is to rotate workers so that you get them doing different jobs to give the muscles and blood vessels a chance to recover in between. And keep hands warm and dry, because cold weather can often stop the circulation in the fingers anyway, so that's going to add to the risk of vibration injury. Workers too need to know about the risks and what they can and can't do. There are things called anti-vibration handles and gloves that keep you warm. The preventative maintenance schedules, often the user of the tool sorts that out for themselves, and they can look at the HSE calculator and digital monitors and make sure they wear them properly and accurately, and they don't fudge the results. On a worker's personal level, they need to be knowing about the early symptoms. Any tingling, numbness, colour change and weak grip, they need to report that to their supervisor. And the earlier they report it, the sooner it is that you can prevent long-term damage, because once you're damaged in that way, then that's it, it doesn't get better. Health surveillance is important for vibration because it gives an early warning system. So the worker may not report any symptoms, but there are a series of tests that you can do, and you can ask about symptoms, you can fill in a questionnaire, that sort of thing. So there's a tiered process. There's a baseline questionnaire that workers can fill in and send in to a health supervisor, an annual follow-up if there's issues, a clinical assessment, and then if there are more issues, then you can have a formal diagnosis, which, if it's proven to be hand-eye vibration, then they would generate a riddle report, and you'd have to report it to the HSE. If you see the control of vibration at work guidance to the regulations on the HSE website, all of this is set out for you, and there is also a questionnaire there that you can use for your own workers to see how they are coping with vibration in the workplace. It's important not to overlook the dangers of vibration and to enforce the idea of the workers they must report it, although they are often afraid to lose their job. But once you get the symptoms and you start to lose the finer movements and dexterity, a lot of people say, I wish I'd spoken up sooner. They can even not be able to use vibrating tools in their job, which is very serious if you are, say, a carpenter or something like that, and your whole job relies on it. So that was a very quick run through the symptoms around hand-eye vibration syndrome and what the employer should do, what the employee should do, what it all means, and giving you some places there to go for further reference. I think the best thing you could do if you have no idea about vibration is go to the HSE website and look at the guidance to the legislation. It's got everything there, and it is a free download. So thank you very much. I hope you enjoyed that discussion. I have got an older video on YouTube, so that has some really good points as well, done in a different detail. I haven't taken it down because I'm still getting a lot of views on it. So thank you very much. Bye-bye.